My name's Anissa, and this is my wound dressing change assessment. So first I would introduce myself and perform AIDIT. I would then go into the patient's room and verify the provider's orders. I'm going to verify my patient with 2 identifiers, provide privacy, and assess for pain to see if they need any pain medication prior to completing the dressing change, assess for allergies, provide privacy. I'm going to put my supplies on a clean table. These would be sterile, but I've practiced, so they're not right now. I'm going to inform my patient that I'm going to be changing their dressing, why I'm doing it, answer any questions that they have, and obtain verbal consent. Then I would raise the head of the bed to the level of my hips, so I'm not bending over and straining myself. I would perform hand hygiene, get my supplies, and put on clean gloves to remove the dressing first, the one that was already on, and I would check for cocoa, which is going to be color, odor, consistency, and amount. So I would remove the dressing. This is what I'm using as my wound also. So I would remove it, check for coca, assess for any eschar, any slaw, tunneling, check the length of the wound, measure the dimensions, do all of that. Then I'm going to take those gloves off and throw them in the trash, perform hand hygiene, put on my PPE, so like gown, any masks, so things aren't splashing back at me. Then I'm going to open my sterile package. First, I will move this for a second here. I'm going to put on my sterile gloves first, which, let's see here. Okay, so I would put my sterile gloves on first. Then I'm going to take my drape here and lay this out. I would have a bag set up so I could discard of all of the things I take off as well. So then I would draw up saline solution, 35 to 60 mLs, so I can irrigate the wound. And when irrigating the wound, you want to work top to bottom, so clean to dirty. And I would take my sterile swab and swab my wound to clean, so from top to bottom, top to bottom. So I would clean and irrigate the wound. Then everything's out, removed from the wound, so I'm going to take my saline solution and I'm going to pour a little bit into here because I don't have any syringes in my pack. But if I did, I could do that. Put that in my trash over here. So I'm going to pour some of the normal saline. And I will next, I'm going to take my gauze and put it in my normal saline. Kind of wring it out. I'm going to pack it in there. Another one. could use a new sterile cotton swab to kind of make sure that it's packed all the way in there. Then I'm going to take dry, put dry over. Then I will take this, put it over, secure with tape. On both ends. Then I'm going to initial and date for when I changed the dressing. So then I could get rid of all of these. I can remove my gloves. I'm going to reassess the patient for pain. I'll remove my gloves, perform hand hygiene, reassess my patient for pain, put the side rails up if needed. I'm going to perform hand hygiene again, make sure my bed's in the lowest position, make sure that my patient doesn't need anything, thank them, and then perform hand hygiene again before exiting. And here's my wound. And that's my assessment.